we're going to look at some side lying positions here just for the general gluteal muscles and a little bit of the deep external rotatus. This is probably my favourite position for working these areas. So as we mentioned beforehand, we talked a little bit about pseudo-sciatic pain, and we know that glute minimus reproduces and mimics sciatic pain just beautifully. And a lot of the time you'll get people coming in who are convinced that they have true sciatic nerve pain, only to be proven that it is pseudo-sciatic pains, which will obviously be the glute minimus. Keep in mind that glute minimus trigger points will also coexist with sciatic nerve pain as well. So once again, it is imperative that you treat that area. So this technique works simple. Have your client in a side lying position with the knee bent, obviously the foot tucked into the back of the knee itself. And we're going to come through once again with this broad forearm again, and we're going to locate the greater trochanter is our starting point. So we're going to sink in, and then we're going to sink along the tissue towards the sacrum, okay? Now, have no fear, you're not going to hit the sciatic nerve because these muscles are on stretch, so they will actually protect the sciatic nerve from actually being pressed upon, okay? So we're working along the length of the tissue, and obviously if we tuck in above the greater trochanter, we're going to come in towards that glute minimus muscle, which is a little bit more anterior than the glute medius, and press on there. The anterior fibers, obviously they will be red hot, and they'll refer deep into the buttock and down the back of the leg, okay? So you can sit on those and just work backwards and forwards, dissipating, make sure that your client can handle that pressure. Come back, re-engage. Yep, there you are, you can find it. Just sit on that area, wait for it to dissipate, move on to the next one. Obviously don't rush this process. Now, once you've worked through those glute minimus and medius muscles, come over back to the broader muscular component of your buttock, and obviously work through and down the tissue, hooking in and then down right up to that sacral border, okay? So working along those fibers, sinking in, once again, being purposeful, hitting that sacral border, blending out, okay? You can do this sort of treatment about good 15 minutes will make a massive difference to the tension and the tonicity and also the irritability in this area.